Hello and welcome to another episode of In Just 1 Minute or So. Today we're going to talk about psychotic disorder. So, psychotic disorders are mental health problems that cause a person to lose some touch with reality. They can cause severe disturbances in behavior, thinking, and emotions. A psychotic disorder can severely disrupt a person's life, the relationships, the work, the self-care. Now, people who live with a psychotic disorder experience psychosis or have psychotic episodes. There are many numerous disorders in which a person can experience psychosis or a psychotic episode, including schizophrenia, depression, bipolar disorder, delirium, and drug withdrawal or intoxication. Now, there are 4 phases that vary in length from person to person during the psychotic episode. The first phase is the pre-morbid, the time before the symptoms start. The second phase is the prodrome, that is where the symptoms are vague and hardly noticeable. For instance, they may have been mistaken for typical teenage behavior. In the phase 3, the psychotic symptoms are experienced, that is, there are hallucinations, delusions, disorganized thinking, and behavior. And finally, the last one, recovery. This is when, with treatment, the people recover from their episode. And some people have one episode and never experience another one. Now, let's talk about the common signs and symptoms that psychotic disorder is developing. Now, changes in emotion and motivation, like depression, mood swings, increased anxiety, suspiciousness, a constant feeling of being watched, blunted, flat, or inappropriate emotion, irrational, angry, or fearful responses to friends and family, a change in appetite, and reduced energy and motivation. And other symptoms are changes in thinking and perception, difficulties with concentration, a sense of alteration of the self, others, and outside world, like feelings that their selves or others have changed or are acting differently in some way, inability to turn off their imagination, odd ideas, also unusual perception experiences like a reduced or greater intensity of smell, of sound, or color, an inappropriate use of language, words that don't make sense to others, and difficulty in controlling their thoughts. And finally, changes in behavior, like sleep disturbances, loss of appetite, withdrawal from activities and social contacts, deterioration in studies or work, deterioration in personal hygiene, physical symptoms like weakness, pains, bizarre body sensations, and sudden excess or extreme religiosity or extreme activity. And the final comment on this, a major reason for delayed diagnosis is that psychosis often begins in late adolescence or early adulthood, and early symptoms involve behaviors and emotions that are common in this age group. The appearance of psychosis in other stages of life is a lot less common. Alright, and that's all for today. Thank you for joining, and see you in the next episode.